is a common networking platform where you have different talents that can be showcased. Simple, it can be poem, it can be something like your artist, drawing, it can be a storytelling, it can be music, it can be even cooking.
You never know, the 9 months, the crucial 9 months which you are in your happy moment suddenly can change into anything during your pregnancy. You can never predict that.
Those people who have too much of bleeding during the menstrual cycles, that is the most important thing in any female. If your cycles are very frequent or if you have too much of bleeding, please consult your gynecologist. They will get your blood tested. In case you have iron deficiency, you have to get treated for that.
Other events, Manipal Sakhi and Bangalore, we had a lot of this elderly care who came, or one competition ittu. Yenandre extempore, 2 ನಿಮಿಷ ಮಾತಾಡೋದು. They were all very excited. Oh, I can talk, I can talk. The moment I said 2 ನಿಮಿಷ, they were like, ah. Why? Women are known to talk. So we wanted to know, 2 ನಿಮಿಷದಲ್ಲಿ, how can you curate a quality content? 2 ನಿಮಿಷ ನಾನು ಹೇಳ್ತೀನಿ, ನೀವು ಏನೇ ಹೇಳಬೇಕಾದ್ರೆ it's okay, but just do it in 2 minutes. You know, they did it so well. We just gave about 10 minutes of time. They scripted. So what are we trying to tell here? They are our future ambassadors. We are asking them, ma'am, if you are interested, please come. You know, we'll arrange a storytelling for all our the women networking platform. Would you be interested? They said yes. That is how this Manipal Sakhi is built. So this is a networking platform where we want to call all women. See, all are unsung heroes here. They have the talent, but they don't want to exhibit. What if somebody thinks, what do they think about me? Right? But we do have great leaders sitting in this gathering today. Obviously, they will be felicitated. But what we are trying to tell is, this is a common networking platform where you have different talents that can be showcased. Simple, it can be poem, it can be something like your artist, drawing, it can be a storytelling, it can be music, it can be even cooking. Anything under the roof. So we do have a small counter here where you can register yourself, but we would require certain details so that we call you on that particular day. Whatever role you want to enroll, please feel free to enroll. And this
almost all of them have nowadays because of the junk food and the food habits. We take care of it like you never knew that you are undergoing that complication in your pregnancy. So according to that, so maybe we give a happier environment to the pregnant lady and make it more joyful than giving them stress too much.
So it's care and convenience. Yeah. That's cool, doctor. Thank you so much. The second thing I have...
Doctor actually. See, the doctor knows what complications you might end up in, which you never know. And we try to discuss it with you. We tell you what the complications are. Like, high risk means any medical or surgical complications that might occur during your pregnancy. It is not just the 9 months. The 9 months is associated with anything. You might get fever, you might get any infection, you might get any other surgical complications, like you might end up with your gallstones, or you might end up with appendicitis. You never know. The 9 months, the crucial 9 months which you are in your happy moment, suddenly can change into anything during your pregnancy. You can never predict that. So in such conditions, that high risk means that the normal pregnancy is associated with some other medical or surgical conditions. So medical conditions like, as everyone knows, increased BP is one of the most important one. This happens only in pregnancy sometimes, and it might continue because the age of the mother nowadays, it's higher, like above 35, above 40, like in IVF conceptions. And IVF conception is also called a high-risk pregnancy because usually the age is higher and associated medical conditions are more. So this high risk comprises of any previous recurrent abortions or anything like that, like previous 3 abortions, 4 abortions. We carry over this pregnancy as a high risk one. Any previous stillbirth that has happened. Stillbirth means the baby dies inside the womb during the term pregnancy, like after 8th or 9th month. So that is also a very high risk pregnancy. We take care. take care that such things never happen again. So we take utmost care of that condition so that never repeats, and we give women the happy child.
Okay, I think the last question I have, because your designation says laparoscopic and it also says surgery. Yeah. Because I think most of you would witness surgery and cut off a knife, open the organ, there it is. But laparoscopic and it's a keyhole surgery. Can you just emphasize what exactly is laparoscopic surgery? Yarge idu ಮಾಡಿಸಬೇಕಾಗುತ್ತೆ madam?
See, nowadays,
so if I have to tell about iron deficiency initially, so anemia means you have low hemoglobin. So normally for females it should be about 12 hemoglobin. So for males it should be more than 13. So when it is less than 12 for a female, we call it anemia. And iron deficiency anemia is when your body is lacking enough iron. So iron is definitely needed for hemoglobin synthesis. So hemoglobin is a part of your RBC. So most of you would be wondering what is RBC. So in blood there are 3 types of cells. RBC is one of them which carries oxygen to all the tissues. So when you don't have enough hemoglobin or RBC in your body, the different tissues won't get enough oxygen. So that body cannot function normally. So when there is iron deficiency anemia, when we talk about it in particular, because in anemia there are a lot of types of anemia, iron deficiency is one of the most common ones which is seen in females. So as Bhavna ma'am told, so about iron supplements when we are telling, during pregnancy it is must and should, everybody has to take. In first trimester, that is first 3 months, it is not advocated because already they have many other issues going on like vomiting, nausea, all that will be there. But from second trimester till the delivery, definitely all of us, whoever has undergone that process, would have taken iron supplements. And yes, iron, it does have its own side effects. When I talk about iron tablets, it causes lot of gastritis and it also causes constipation, like your motion becomes very tight. Many people might not feel very comfortable in taking tablets. So there are injection formulations nowadays, but again, we have to see who actually needs injections and who can be managed in oral form. That is one thing. And as ma'am said, after pregnancy, so what happens? Do you have to take iron supplements? So if you have any of the symptoms of anemia, like if you're feeling very tired, you were able to walk for like good distance before and now you're not able to walk for that much of distance, you're not able to climb stairs, you're feeling very tired. And for females, one of the common symptom is hair fall. So these are some of the common symptoms of anemia. So get your blood tested, check your hemoglobin level, and if it is low, please consult a doctor. Doctor will see your test and then ask for the iron test. It is not that you have anemia and get your iron tested. If iron is low, then you have to take treatment. So when you talk about supplements, it is when your levels are normal, you are just trying to maintain them at the normal. That is supplements. But if the levels have already gone low, then it is treatment. It is called treatment. It is not supplement anymore. And one more thing is during lactation, as I think they'll be knowing, you don't have to take too